An ischemic stroke is when there's a blood clot that usually forms in the heart and then shoots up to the brain and blocks the blood flow, or a blood clot or a plaque from the artery in the neck called the carotid artery shoots up into the brain and blocks the blood flow. And my job is to come in emergently and try to reopen that blood vessel that's blocked. We do that through minimally invasive technique, either with a little needle in the wrist or a needle in the leg, and I snake a little tube up and either suck the blood clot out or use a little basket called a stent retriever to pull the blood clot out to reestablish blood flow to the brain and try to keep the area of stroke. And all stroke means in this setting is brain that has died. Keep that amount of brain to a minimum. The symptoms of an ischemic stroke we often hear about, typically if you have an acute onset or a sudden onset of speech difficulties, where you can't get your words out or you're speaking gibberish or you see someone else speaking gibberish. You get weakness of your arm or your leg. You get double vision or blurry vision or balance issues. That's a concern that you might be having a stroke and you would want to call 911. There's a saying that we use that time is brain. The longer it takes for you to get that treatment, the worse you're going to do. So as soon as those symptoms come on, or as soon as you see those symptoms and someone else come on, calling 911 is by far the most important thing to do so they can go to a stroke center and be taken care of.